Today I wanted to touch on the subject of what are the problems or complications or pitfalls that can happen around breast implant revision surgery. As you know, this type of procedure, this type of surgery is more complex, more challenging than the primary procedure, whatever that may have been, either it's been a primary augmentation or reconstructive procedure. So today I want to talk to you about some of the things that can go wrong in that surgery and something to be aware of. All surgeries have potential pitfalls, not just this, but more complex surgery has potential for more problems. Something for you, I'm sure you can understand. The common things that are true for all surgeries that we perform are, of course, infection and bleeding. This can happen in any procedure, including this one. The risks are generally low, less than 1% of the time, in good and safe hands, but it is something that we're constantly concerned about. You've typically had some scar tissue develop when you've had your original surgery. That's called capsule or capsular contracture. There's a definite risk that you can redevelop the same thing, and sometimes even worse with your secondary procedure, with your revision procedure. There is a condition called ALCL, which is a rare type of lymphoma associated with some of the textured implants, such as this one here. The risk is quite low, 1 in 15,000 to 1 in 30,000, but it's not zero. And having subsequent revision surgery restarts the process because the implants tend to be different when we replace them, and it does relate to a particular implant. Is there a risk to a loss of sensation to the areola or nipple or the skin? Only very small, but it is there. It's definitely not zero. So those are the common things that we potentially can encounter. I guess another important thing is that the aesthetic outcome, the result, may not be what you're expecting. I always mention to my patients that secondary procedures are much more challenging to get that really nice aesthetic result, even if you're starting from not a bad position. And that is because of all of those potential problems that we can find internally. And this is where the surgical expertise really comes in its own. So to sum it up, I think it's a procedure that's generally quite well tolerated, but depending on what is done, may have some more increased pain compared to your original procedure. This is particularly true if we have to do a capsulectomy or a total capsulectomy, where we have to take the capsule off of the chest wall in particular. That can cause a little bit of pain, and that can be longer lasting than typically, for instance. But otherwise, the pitfalls may be fairly similar to your primary procedure, with some slightly increased degree of these potential complications or the risks of them.